about 2 years ago, I got a very unique phone call about building a network for an ACO. And so it was an ACO in Chicago, and they were charged with delivering a certain level of care to South Chicago, to a population that was different in their behaviors in consuming health care than anywhere else in Chicago. So it was a very unique, if you understand South Chicago, that's a challenging place because there are very few clinics, very few physicians, no hospitals whatsoever, and the population has gotten accustomed to not requiring care, not relying upon the system for care. So it was a really interesting, very, very interesting challenge. And I learned a lot about ACOs from that experience. But then we set out a couple of years ago as well to build one of the nation's largest networks of direct surgery contracts. And we were deploying those contracts through ACOs. And so what I wanted to share with you today is my experience as a member of an organization building a network to serve in the ACO environment, and what are the unintended issues or surprise issues that pop up that might not be discussed at a big conference. So one of the things that we think about, that I think about quite a bit, is an ACO looks like this to me. It looks like a big, monstrous behemoth organization run by really rich, highly educated Princeton, Wharton, Harvard grads, all white, all 65 and above, and all of them who don't go in the system anyway. They have concierge doctors anyway, right? This is my problem. This is what I deal with all the time. And let me say, I'm not an expert in hospice like you are, but I know what it's like to have my industry be manipulated by legislation with people that have no idea what we do for a living. And they write stuff, and they vote on it, and it's law, and they have no idea. They've never done it one day in their life. So it's a pretty big challenge. This is my perception. So I come with a little bit of a negative bias, and I'm going to try not to have that, okay? Because it's not completely fair. So what I want to say is that when I think about building a network or being included in a network, these are 4 areas that I think about based on my years of experience trying to be included in networks or building a network for resale. Okay? Territorial impact is the first one I'm going to go talk about each one of these. But there's a difference between being in western Kansas and being in Kansas City. So we'll talk about that in a moment. Because although a ACO may only choose 3 or 5 hospices, they can't choose the same hospices in Kansas City as in way out in Garden City, which is 2.5 hours, and there may not be a pharmacy or a clinic for miles, right? It's a different model. Then we're going to talk about operational excellence, because there's a big difference between what Medicare wants as data and what the ACO needs as data. You have to realize those are separate sets of data requirements, and each ACO is going to have their own established set. Financial strength. An ACO will require of you certain financial obligations that you will have to demonstrate to participate. Okay? And then finally, cybersecurity is an enormous topic now. Every ACO that you deal with in the future will require a full-blown cybersecurity plan. We'll talk about that now. Okay, so operational excellence. We talked about some of these things. There are operational benchmarks that we normally have that are hospice related, but the ACO is going to say, well, I need this list, and it's a page long, of operational issues that are not directly related to hospice. And that might be things about how quickly you store data, how quickly you pick up a phone call, how quickly you respond back. What is your, it could be a list. It may be a list of 1.5 pages long of items that you're going to have to go through and say, do we comply, or do we even want to comply? with these things. Okay? So some of the metrics you'll find are going to be very reasonable, and you'll say, that makes a lot of sense. You'll also find, as you go through them, there are going to be ones that are very unreasonable and things that you'll be embarrassed to say, I don't even know how to respond to that. Okay? Because what happened is the rules are established by somebody outside the industry, or they're trying to apply a different part of the industry to hospice, not knowing that it really doesn't impact in the hospice organization. Financial strength. It is not uncommon that they will require 3+ years of audited financials, and it's got to be from a branded CPA. Now, when I say branded CPA, you can get audited financials from the guy or gal down the street for a couple of $1,000, and it's pretty much worth what you pay for it. Okay? But a big ACO may require or may say this one doesn't pass. And that's fair. Realize that when I talk about these things, in my mind as a business owner, I think about how much that's costing me. So here's what we're dealing with. We're dealing with a industry change in which we're getting a haircut of 15% if we're going to use 85% Medicare. We're already struggling with very, very tight margins. We're struggling with the cost of employees and the turnover. And you and I know how much it costs us to attract and bring in and train a new employee and then pay them. So we're working on this much margin, and then we're getting a haircut, and now we're getting fees added to us because the audited financials cost you money. And look at this one in the bottom, high insurance minimums, the coverage demands. A big organization, let's say that the ACO is a hospital organization in the community, they're going to require much higher liability insurance minimums than you normally get. And they might even require that they're mentioned as an additional insured. So not only are you getting a higher cost policy, but you're changing who is insured into that policy. Yes, Jen. They will be all over the board, but 1 in 3 will be the bottom. That'll be the lowest. Okay, we're seeing things like $5 million cyber with a $2 million per episode limit. You know, things that, and I read it and I'm thinking, I understand the words. I understand all these words, but when you put them together, I'm not sure what you mean because I can't anticipate your meaning of why you put this sentence together. So it requires a lot of dialogue, okay? Oh, on the strong balance sheet. So one of the things that you have to realize too is that if you've made a very significant investment in your hospice and you've got debt on the balance sheet and over a period of time you haven't yet made enough money to pay off the debt because this was a long time investment, then you have a negative net worth and you're kicked out. So you have to start thinking about, it may not ever happen, but it is something I see from a balance sheet perspective that worries me. A negative net worth, even though you're making money because you have a lot of investment in the company, might kick you out of the possibility of being included. Okay, cybersecurity. When we think about cybersecurity, here's what I want you to know about this. There are multiple vendors that can give you a certification. Okay, we're going to get more of them. Now, what do we deal with is you and I go out and we get SOC 1 and SOC 2 cybersecurity, right? And then the vendor that you want, the ACO that you want to sign up with, requires a different cybersecurity. Well, last year, I already paid $40,000 for a consultant to walk me through SOC 1 and SOC 2. And then SOC 1 and SOC 2 cost me X amount per year. And now you want me to do another one. And my margins are so tight that I don't really know if I can afford to hold SOC 1 and SOC 2 and go get another one. What if the ACO, they're kind of snotty IT people, you know? And so their IT people say, well, those are crap. This one's the best because I was part of the design group to come up with the cyber requirements. This is what we're really going to be looking at. It scares the dickens out of me, okay? So I don't want to scare you yet without thinking about what might be some of our options, okay? The reality that was spoken about in this group, and I want to reiterate it, and I realize I built this PowerPoint weeks ago thinking about it, only to have it validated by what you guys said. So I'm so happy because I was going to say, oh, I don't even need to present, but I want to reiterate. There's nothing, okay, business rule number one when you go to grad school of business, politics is too important to be left to politicians. Do you think politicians make decisions without thinking about their checkbook? We have to be very political creatures, whether we want to or not, even though we got into hospice because we didn't want to be political. We didn't want to play the games that everybody else does. But the reality is there is going to be somebody in your community that wants to be the hospice associated with the ACO. They're going to run to the opportunity. And if you don't, you're going to get left out. Even if you're a big brand, even if you're a very well-known commodity, you've got to play this game. So get involved early. How do you get involved? You call them and you tell them, hey, I want to come over and introduce you. I want to let you know what we do well, what we're struggling with as an industry. We want to be part of. If you ever have a committee to explore moving more deeply into hospice, we'd like to be involved in the committee. So what you're going to really be doing is asking to be part of their thought process of developing hospice as part of their ACO solution. And so you want to get involved very early, serve on committees, and make contacts with influencers. If you know somebody is a consultant to the ACO, take them to lunch, get to know them. You've got to have your name be part of the puzzle. If they sit down in this big group, and that's why I use that picture earlier of what an ACO board looks like, you want at the very first meeting, when they say, how many hospices are we going to include? Well, they're going to start naming them. And this is not going to be scientific. It's going to be very political and very relationship driven. And if they know, well, we need to include this one and this one, but these two are also really good, you want to be one of those that is referred. Okay? So get involved very, very quickly. Get involved early. Okay. The urban MSA, urban MSA is going to be driven by size and brand. So whether you like it or not, if you're a small player in a big city, you're in danger. Okay? That's when you need to be ready for this. If you're in a rural environment and you're a good player, you have a safer position. Because a very strong hospice, and I'm using Kansas City because Jeremy was, if you're a very strong player in Kansas City, you are not going to drive 3 hours to Garden City. So you will use the ACO is going to use the rural hospice as part of their network. Now, the rural hospice is usually smaller and usually has more expenses or has significant amount of expenses with travel, and they have a limited portfolio of people to draw from for employees. So they've got their own challenges. So they're going to decrease by 15% reimbursement, but now they've got SOC 1 and SOC 2. And then they've got all these database management requirements. This is going to be really tough. So the urban ones are going to be driven by size and brand. You don't have to win. You just have to be included. Get involved early. Even if you get just a little piece of the pie, you can start to grow your piece of the pie. But if you're left out, you're out. So we got to get started. Rurals, I think they're going to be dealing with the highest cost to be included as a percent of their total revenue. That's what concerns me about the rural environment. Okay, bottom line, you must be purposeful. This cannot be left to chance. You got two choices, and you need to control your destiny. Either you make a very significant investment in compliance and branding and technology. By compliance, I mean all the things they're going to demand upon you to get this done, not just within the space of Medicare, but within the space of what the unique ACO demands. Or you're going to have to join some kind of association. I believe personally that this is a time to really start considering binding together into a group that shares the cost of some of these things, like cybersecurity coaching, data warehousing, these kinds of things that could be shared across a community. I'm not selling anything here. I'm just proposing that we should consider as a group, maybe this is a good group to build an association. To have an association, what we'd be focused upon is the things that really drive value to the members. And it would be these things. Knowledge. Can we coach each other through the process? And if ABC ACO in Chicago requires all of these items, but you're in Denver, could you have a friend in Chicago that says, this is how we did it? That would be very, very powerful. Because one of the toughest things is reading the requirements of an ACO and feeling like you're all alone. You're on an island. How the heck are we going to do this? I don't even know how to answer this question. But having a repository of data on how to answer those questions and a report that might show an example of what you could provide to the ACO would be incredible. So not just the knowledge, but the tools to be able to comply with the mandates of participation with the ACO. Did that make sense? Okay, I hope so. So, although I put GPO, I do believe that when our margin is compressed and we get a haircut, we've got to find some kind of capacity as a group to use our size and strength and our influence to get better pricing. I didn't mean an actual GPO, but I meant as a group, could we have more influence in negotiating great prices to survive? The report that's required for the ACO on the supplies and the drugs and the DME and all that's a different matter. Survival is about buying things at the right price. Okay? Yes.
You have a great idea. You and I have talked when we first met about insurance, right?
Yes.
As a group together, that's what we all battle when we're smaller entities. We can't compete with, let's say, Kindred. We can't compete with VITAS and what they're able to buy as far as healthcare insurance, because we're all battling retention, we're all battling employee culture. But coming together, then we do have a say and can move the needle more in our direction.
Yeah, so you bring up a great point. Thank you for bringing that up on healthcare. Healthcare is a very frustrating part of our cost structure for everybody. And I cannot create, so the federal government did away with MIWAs, Multiple Employer Welfare Associations. And the only people that can do that legally are Union Taft-Hartley. That's the law that allows them to do that. But we can jump in and start to get better rates if we're part of an association that was created with a purpose other than healthcare savings. We happen to be a group of people who have been meeting for 10 years on education and development and support, right? We have 10 years of experience being friends already. So theoretically, we could, as a group, start buying healthcare as a team, and we could do it legally. It is not easy. It's a huge challenge to overcome because every state is different, and it is one of the things that I do in my life that I would like to do less of. Healthcare is the least amount of money I make in my life with the most amount of work. And I want away from it as fast as I can, except for the fact that I care deeply about hospice and how hospice is struggling to afford healthcare services. Oh, goodness. It really is. Debbie's back there going, no, walk away from this conversation right now. It really is the Achilles heel of the small hospice. And how do you afford family care at $1,500 or $2,300 for a family? How does a nurse's aide, isn't this now you're going to get, now I might cry here in a minute. I'm going to cry here in a minute. How do you have nurses' aides busting their tail, and they're the greatest people in the world? I love them. But they can't afford a copay, or the only thing we can afford is a high deductible health plan, but yet I can't give them any first dollar coverage because that breaches my high deductible health plan. So I can't give them free telemedicine. I mean, these are the rules that are getting established by the state legislators, and they don't have any idea what they're talking about. So I'm with you. I'm really frustrated about it. This is what scares me about this as well. Okay. These are 3 rules I try to live by. Soon is not a time, some is not a number, and luck is not a strategy. Either we figure out some way for everybody to have a better chance of participating in every ACO, or we're all kind of out there on an island together. I mean, alone. So my hope is that part of the dialogue, maybe tonight or at dinner or lunch, let me know if you're interested in us trying to move toward an association of like-minded individuals qualified to almost immediately submit an application to ACOs and be approved, or at least get us 95% of the way. And then if you live in some crazy state that requires some crazy extra, then that's all you have to provide. But I believe that together we'd be much stronger than we would be separately. And I think we as an organization at Sono are prepared to move in a direction with hiring people, staff, to make this work, because we can't do it. We've been doing a really nice job as a conference with only 1 employee, okay, and without ever asking anything from dues or membership from any of the participants. But if we wanted to go to the next level and provide real value to this community, it's going to be an investment of every participant here to get us started, and then be able to demonstrate how much value we could provide to people that have never come, okay? So what I've shared with you is kind of my fears, but I believe that we stand a much better chance of surviving the haircut if we do it together, and if you're prepared. It will shock you when you get an ACO agreement that is 75 pages long, and the last 20 pages are requirements that you have to comply with in order to participate at a 15% haircut. It's a shock. So this is what's real and where we're going. I wish that everything we talked about was sunshine and roses, but it's really not. And the only thing that's worse than not talking about it, I guess there's nothing worse than not talking about it. We can't pretend this isn't coming. One of the things we're going to be talking about this afternoon is artificial intelligence. Tomorrow, we're going to be talking about the changes of what employees deem are important to them. And I think you're going to be shocked at what the new research is telling us that employees care about. So I think we're going to touch on a lot of the really important topics. I will also say, very importantly, today at 1 o'clock, Ryan, will you wave at us? You can't miss Ryan because he's, he decorates himself beautifully. Anyway, he's a dear friend of mine, and he is a radical thought leader in social media and digital marketing, which, as you guys know, has been something I've been pressing for years. This is critical. It's not an option. This is how you let people know who you are and what you're doing. And I asked Ryan to come in and not sell you, but to talk about non-traditional industries that need to use digital marketing and social media as part of their overall marketing platform. Okay? So we're going to do that at 1 o'clock. Debbie, I'm going to have you come up and talk about lunch. Does anyone have a question for me? Chad.
You mentioned some type of sono being a place for some type of community, right? I think it's a good time because coming off of the Texas Mexico board seats still on there, there's a lot of talking. I had been at board meetings just about us trying to draw in other states because we would often have other states that would send members from other hospices, Colorado in particular, that send to local state organizations. NH9 and NHPCO and legalists, they're talking about merging. So I think, not to necessarily be a competitor too, but just a different community that could be national representation. Because right now, as an owner, I'm having to choose between the local state organization and where I can do NHPCO because I just can't afford to do both. Send people to all the time.
Fortunately for you, Texas is a really good group. They're really a leader as far as a state organization. I think about it from a business owner perspective. I don't think about it globally. I have to think about all the little stuff. I know that when I open a contract that I want to participate in, I wish I didn't feel alone. I wish that there was a repository of data. I wish that I had 8 people to call and say, what did you do? Can you share that with me? I wish that we were buying together. Those are the kinds of things I think about because these are the checks business owners write. You write a $25,000 check to be included in something, and it's really frustrating. Yes, last question.
I was just going to say, so we started, it's called the West Virginia Hospice and Palliative Care Network. It includes 5 not-for-profit hospices, cover about 80% of the geography of the state, and an equal amount of the population. And we actually started having this conversation under the auspices of that clinically integrated network. And the company that we use, and I don't know if somebody knows, USI. And so USI does a lot of the MIWAs or whatever they are. They do a lot of that structure. And so it's certainly a very interesting model. I think what we found early on was there was a lot of discrepancy between coverage options. So you as an employer may offer your people all these things, I may offer all these things, and coalescing all that together can be a barrier, but certainly there is cost savings. It's very much like a capitated model. We're a captive ourselves.
Yeah, that's what I was going to say is that the big savings is the captive that shares the risk across the platform.
Correct.
Yes.
And some of the PBMs, the pharmacy benefit manager, and some of these other nuances that you can build in to create kind of gatekeepers so that the expense doesn't get out of control.
Yeah, and I'll say, but I don't want to get too much into healthcare because that's a whole, lots of discussion. But there are really good tools that an organization can use, but you have to buy them and figure out how to integrate them. For example, a legacy contract with telemedicine that allows the patient to have 0 cost out of pocket improves their compliance with calling telemedicine and decreases emergency and urgent care visits like crazy, decreasing our costs. So if you want to talk about those things anytime, Mike, I'd love to chat about it. But Debbie, tell us about lunch.